Hello, my name's Rhonda Winegar. I'm a family nurse practitioner in Austin, Texas, and I currently work in a sleep and neurology practice. The article that I'm sharing with you in this month's edition is titled Breastfeeding in the Workplace. I hope you find this article informative and helpful as you guide your patients into deciding whether or not to breastfeed or whether or not to continue breastfeeding once they return to work. I originally wrote this paper for my DNP healthcare policy class and later polished it with a colleague to make it suitable for publication. The article starts off with a brief overview of breastfeeding, discusses benefits of breastfeeding, outlines state and federal legislation that can impact nursing mothers, discusses resources that are available for mothers that choose to breastfeed, and finally outlines the NP's role in breastfeeding. Breastfeeding has always been an area that I hold dear to my heart. I originally started out as a registered nurse in a small rural community hospital and frequently gave breastfeeding education prior to delivery and then after delivery of the mothers that I was taking care of. Later, I switched to pediatric nursing, and I was frequently the first point of contact for those mothers. They had never seen a breast pump. They had no idea how to use a breast pump. And even though the patient was their child or their infant, I would frequently have to assist the mothers in showing them how to use a breast pump, how long, the need to rotate the breast, the need to dry nipples before putting them away or getting excoriation. I had to talk to them about the need to maintain adequate milk supply and to prevent engorgement, that they needed to pump frequently or breastfeed the infant frequently. I myself breastfed both of my children until the age of 2. Even though I was a registered nurse, and you would think that healthcare providers would be aware of the need to maintain an adequate milk supply and would be one of the strongest proponents of breastfeeding, I was not afforded breast pump breaks and was also not given a place to use a breast pump or given an adequate place to store the breast milk after I had used the breast pump. Frequently, as a registered nurse, you guys all know that we're not always given breaks on time, and I would have to choose between getting a drink of water, using the bathroom, getting something to eat, or using the breast pump for a short amount of time, and nowhere near the 10 to 15 minutes that is recommended to empty your breast. I also did not have a place to use the breast pump and would frequently find myself in the public restroom on the dirty floor next to an electrical outlet so that I could use my electric breast pump that was more efficient and that I could breast pump both breasts at the same time. This led to me frequently having engorgement. It also led to me having an inadequate breast supply at times, having to supplement with formula, and I did develop mastitis twice with my younger son, and all of these could have been avoided had I just been given adequate breast pump breaks, private area to use a breast pump, and storage facilities. I decided to become a DNP after I had been a family nurse practitioner for 10 years. I was working in academia and was in the process of assisting with the development of the FNP curriculum. Once I started really diving into the curriculum, I became so much more aware of areas that I was not educated on, especially leadership, evidence-based guidelines, clinical practice guidelines. I had never been taught anything about any of those, as well as healthcare policy. I decided to go back and get my DNP to make me a more well-rounded teacher as well as an advocate for my patients. I researched many programs throughout the United States and finally settled down on St. Louis University's DNP program. I really liked that this program was a Jesuit-based and research-focused. I've had my DNP since 2014 and feel like since I've gotten my DNP, I make better clinical decisions when taking care of my patients. My clinical education for my patients is more up to date. I incorporate evidence-based guidelines, and I feel I'm a more well-rounded provider now. I am no longer working in academia, but I still serve as an educator, especially for new nurse practitioners coming up, and would highly recommend continuing to get education, and the DNP program really enhanced my learning. Thank you, and I hope you enjoy my article.